So I was reading a study actually that weightlifting, lifting weights or strength training, what they call it, is helps the patients with diabetes type 2. There's some study I was reading, there's a correlation that can help. So is there a type of exercises that you would recommend that do, I'm just trying to understand, like, would you say, okay, do aerobics versus weight training versus walking, or is it just move yourself, a level of detail that you go into as a doctor?
Right. So again, it's patient centered. So yeah, I'm aware of the study. And so the study on strength training showed that patients over 60 or 65 benefited from strength training, muscle building, aerobic type exercises. So in younger patients in their 30s and 20s, there wasn't so much of a correlation. So with younger doing aerobic exercise, it helped with mitochondrial regeneration and growth, which helped a lot with outcomes and improving blood sugars and helping with a lot of health parameters. So just generally, as a very general statement, I would say if you're young, then concentrate on aerobic. If you want to do some strength training, you can do it. We don't know if there's enough data yet to suggest improve outcomes. I know there's improved outcomes in terms of certain parameters for younger people. In people over 60 or 65, there's also waste that comes with aging if we don't do anything to reverse it. So when we included strength training in more senior people, that they got a benefit as well. So we would do aerobic for all ages, young and older, but we'd add some strength training to the patients who are in their 60s, 70s, maybe 50s. So again, coach, a lot of times our coaches have some, they may not be certified in strength and conditioning, but they have a good level of effective training for diabetes and other illnesses. So I think it's important that we talk about making sure that you don't try to make bodybuilders out of these people, but we try to just increase their diabetic efficiency, so to speak, by keeping their blood sugars stable. Again, remember, it's the insulin, which is very pro-inflammatory. We need to reduce the insulin.
Mm-hmm. Got it. So what about the supplements? Do you also recommend supplements, or only the diet and the exercise for diabetes type 2, or?
So we have a number of supplements at Bay Area Wellness Center, but I think the patient really has to understand that supplements are what they say. They're supplemental.
Yeah.
You can't eat poorly at a fast food restaurant and take a few pills of chromium and you'll be okay. So we stress, diet, lifestyle, exercise, stress management, and then we give certain supplements that help with the beta cell regeneration or with reducing insulin resistance or help with balancing blood sugars. We just don't believe that you buy some pill off the counter and you can do whatever you want. I think you're going to be really, really disappointed in that. But we do have a number of supplements. But see, the problem is to do everything right may be tough. So the supplement helps to short circuit or reduce the time curve till you get to the associated level of improvement. So again, we may back off because what we hear at Bay Area Wellness Center is, Doc, you got me on 14 supplements. Don't you think it's too much? And we know patients, they're financially or just they're going to burn out. So we tell patients, this supplement you need to take for 2 months. This supplement you need to take for 3 months. This supplement you need to take for the rest of your life. So they have an expectation, but we never say, you know what, do whatever you want. I can just give you supplements. That would be a false, supposition.
So supplement is just a supplement, and the main focus is on the diet, lifestyle, and exercise. And supplement is just kind of, helping a little bit to the next level.
Medicine, food is best medicine. We really try to instill that, and also I think the other thing about functional medicine, it's a collaborative approach. It's not a top-down approach like
Yeah.
traditional medicine 60 was, where the doctor walked in and said, you're going to do this, you're going to do this, you're going to do this.
Yeah. That's
As we
right.
done now, half the time, 30% of medications are never filled. So it's our job to really understand what's going on with the patient. And when a patient says, you know what, you gave me that script, I looked over the side effects, I decided not to fill that script. So it was my failure not to communicate better with the patient. Or the patient will say, Dr. X gave me this prescription, I threw it in the wastebasket. So it's really important for us to listen. And if the patient feels they're a partner in it, as opposed to, a fatherly approach where doctor is telling them what to do, I think you get a better outcome. Because again, it's their struggle, it's their challenge getting through the diabetes, right? We're just there to coach. And if they're not able to open up with us, I think there's a failure. I mean, a lot of times I'll hear stuff from the coaches that the patient never told me. It's like, I never knew that. So again, we can do a better job as practitioners, I think, to really listen to patients. And I think if we're able to do a functional visit that lasts 30 or 60 or 90 or 120 minutes, we get a lot more than if we're doing a 7-minute visit.
Yeah, which most of us have been used to in the last so many years. You walk into a doctor office and the doctor comes, and you have to, sometimes you have to be so quick in trying to explain, and then a lot of times you forget, and because in 7 minutes there's a hello, hello, how are you doing? That takes about 10, 20 seconds. So I love this. Love this, what you're doing, like really understanding it's a patient-centric healthcare model. So, so let's say if a patient really follows your guidelines with the coaching, with everything, what is the approximate time frame for if someone can really start feeling much better? I don't want to use the word reversal, even though we put it on the slide, but what they're looking for, 3 to 6 months, or they have to continue? I mean, what is the time frame you're looking for?
If they've been eating poorly, it depends. If they've been eating poorly, probably 30 days, they'll feel the best they've felt in years. Okay.
Wow. 30 days.
Because what happens, what happens is patients are eating oatmeal because they say, well, it was told it was good for me. It helps with fiber. And they may be one of those patients that like oatmeal, like myself. I can't eat oatmeal. It's like eating pure sugar for me. So you can give me any type of steel cut oat you want. I just, my system is sensitive to that. And there's other patients that are like that. They just can't have that. So the trouble is when you tell them, well, we want you to have protein at every meal, they may not be used to eating protein for breakfast. So again, unless you tell them what to eat, they go out of there and say, well, he told me not to eat this, but he didn't give me an alternative. We need to give our patients viable alternatives, So then we have them check their blood sugars. Then like things like juice, they say, well, I saw on the TV a big glass of juice is good for me. So that's pretty controversial, but just in as a generality, I mean, if you're having a commercial glass of orange juice, it's going to jack up your sugar to a high degree. In fact, remember that when type 1 diabetics have a low blood sugar, what do? They give them a glass of orange juice to raise their sugar right away. So we work with them, and again, we do it in a way where we're all learning. The doctors are learning, the practitioners are learning, the patient is learning, and we try to do it in a way where they feel comfortable to ask us questions, because I don't know everything about diet, but I know a few things, and if I can help the patient, or my coach can help the patient, we can get amazing results. They'll lose 7 or 8 pounds. Their blood sugars will be excellent in 30 days. Again, we're not saying you've reversed diabetes. We're saying that you've got less of the yo-yo of the blood sugar around. So it's based on how much input they want to put in. Patients are working 2 jobs, they're taking care of elderly parents, they're homebound because of COVID, they have their salaries been diminished. So we really have to be sensitive to patients where they are. And again, because we're not treating a disease, because we're treating a patient, we're working with a patient. Hopefully we have more information to make it a viable type of lifestyle changes that's doable for them.
So the other thing actually was the mind, right? I think there's have been a lot of studies that have been done, how our mind can affect our personal health. So is that also mindfulness, meditation, is that also part of your overall protocol that you talk about to the patients?
Right. So initially we would recommend some apps for like meditation or yoga. I think we're in the process of trying to do something that the patient simply logs on to, and we can help direct that. We're not there yet, but the idea would be to give them a few choices. The other thing is people work during the day, they work during the night. You need to have something that that's flexible enough. But stress is at the basis of 80% of primary care medicine. And in a 7-minute visit, you'd be surprised what you miss. And we've learned some things about our patients that we didn't know. Patients have been with us for 5, 10, or 20 years. So being able to spend more time with them has been a blessing for me, and hopefully the patients gotten some benefit, because they're not going to get into depression in 7 minutes. In 60 minutes, they all do. I've had 3 patients this week. So, doc, I think it's about time we discuss my depression. And it's like, kind of out of the blue for me. And we were able to spend 30 minutes because I had like a 2-hour visit with them. So we talked about alternatives for that. And I think if you miss that, then, I don't think you're as skilled a healer, because we really need to know where our patients are coming from. I mean, before the COVID, we would do home visits on occasion, and it was very enlightening.
That's great. It's excellent. Any questions from anyone, you're welcome to ask. Anyone can also, I think I forgot to put our email and website here, but nourishtalk.com and care@nourishtalk. You can send, emails or inquiries. And thank you so much for Dr. Frank for being with us today. Anything else you'd like to add before we wrap up today?
Again, I would say for patients who resonate with this type of functional medicine, that they can find doctors. They can go to IFM, and there is group visits. So if they don't have a lot of discretionary income, there are doctors doing group visits, and that's made it affordable, sometimes as low as $25 for a group visit or a session, because I think, United States is 37th in health outcomes, and that's really poor for them. We're the number one in expenditure per patient. We're 37 in outcomes. That's just not good enough. So by doing medicine, we want to improve the health of our communities, and our health is sacred. If we can partner with somebody who believes that, then I think we can go further down the line.